The changing accounts from President Trump's doctors about his coronavirus treatment has created a credibility crisis for the White House.
He has not received any supplemental oxygen?
He's not on oxygen right now, that's right.
Why are
His
you
lungs,
so
are there any
reluctant until
obesities? Are there
today
anything?
to disclose that the president had been administered oxygen?
It's a good question.
Thank you.
I was trying to reflect the upbeat attitude that the team.
On Sunday, Trump's medical team reported that his blood oxygen level dropped suddenly. It was the second time in recent days. A day later, however, the president's doctor said he was being discharged from the Walter Reed Medical Center and that he was continuing his treatment at the White House.
Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the president's safe return home, where he'll be surrounded by world-class medical care 24/7.
The president has an aggressive mix of treatments, including a 5-day regimen of an antiviral medication, as well as monoclonal antibodies, an experimental treatment still in clinical trials. He also receives steroids, vitamin D and zinc, and an over-the-counter drug to reduce stomach acid. Howard Greller, a toxicologist who has seen many COVID patients, explains what each means.
The first is Remdesivir, which is basically it's an antiviral agent. The best analogy to it would be something like Tamiflu, which is, I think, a drug that people are familiar with influenza. It's still being studied. And here's where it gets tricky. It's primarily been used in patients who have been sick, hospitalized and sick. And part of the reason for that is because its access to the drug has been limited. And part of it is we're still trying to figure out when is best to give the drug and who is best to give the drug to. You may have heard of that previously called convalescent plasma. So basically people that survive having COVID, you then take out the antibodies from their blood and then use them to treat people who are actively combating the disease. This is something where it is a lab-created antibody against, I believe it's 2, which is why they're calling it a cocktail. They're looking at it in order to see whether or not it can both prevent and or treat COVID. Dexamethasone is a drug that we've used therapeutically for decades. It's used in a host of inflammatory conditions ranging from, asthma to different allergic conditions to arthritis, like a whole host of things. And it's a potent steroid. This is by no means a cure-all. It's an additional tool to fight the virus, but one that seems to have good data to support its use in sick people. Its effectiveness is questionable. And certainly, it has some negative side effects to it, and it can have some significant side effects if too much is given. Yeah, I mean, vitamin D is an important vitamin, and it's an important thing, especially in people who are lighter skinned and who do not have regular sun exposure. And so typically in, wintertime, Caucasian individuals are vitamin D deficient. It's Pepsid, to use the brand name. It's an antacid. There was an association that was noticed that patients that were admitted with COVID that got famotidine or were on famotidine prior to hospitalization did a little bit better. But that association is not proof that famotidine is a therapy. Adding more drugs, adding more therapies is not always better. And I think that that's a really important point, because the more you add, the more chance there is that you're going to have an interaction or a problem amongst the things that you're adding. And when things have not been studied that say A goes with B really well, right? You're potentially introducing risk rather than benefit. And that's why, knowing a little bit more would be helpful in trying to parse this out.